Good afternoon, sir. My name is Rovijean Petre, and I'll be trying to assess your cranial nerve number 7, 8, and 9. And by the way, I'm a medical student from Dagupan City. Is that okay, sir?
Yes.
For cranial nerve number 7, or facial nerve, it has both sensory and motor components. For motor, it innervates many of the muscles of facial expression. And for sensory, chorda tympani branch contains fibers from the anterior two-thirds of the tongue along with secretomotor fibers to the submaxillary and submandibular glands. So first, sir, I'll be trying to tap your head. Is that okay? Okay. Sir, can you please raise your eyebrow? Okay. Sir, can you please close your eyes and try to open? Okay, thank you. Sir, can you please pull down your mask? And please try to smile. Show your teeth. Okay. And please blow your cheeks. I'll be tapping on the side. Okay. For the disorders in cranial nerve 7, we have facial weakness, and it may manifest as flattening of the nasolabial fold and drooping of the lower eyelid. Another is Bell's palsy or peripheral injury to cranial nerve 7. And this affects both upper and lower face, and central lesion affects mainly the lower face. Another is unilateral facial paralysis, and this manifests as mouth droops on the paralyzed side when the patient smiles or grimace. Another is peripheral cranial nerve 7 lesion, and it paralyzes the entire right side of the face, including the forehead. And lastly, central cranial nerve 7 lesion, which paralyzes the lower face but cortical innervations to the forehead is preserved. Sir, we will now move to cranial nerve number 8. Cranial nerve 8, or vestibulocochlear nerve, carries sound impulses from the cochlea to the brain. Prior to reaching the cochlea, the sound must first traverse the external canal and the middle ear. So please close your eyes and tell me if you can hear the sound on your right ear or on the left ear.
Left ear. Right ear. Right ear.
Okay. Sir, I'll be placing a instrument on your forehead and you will hear a sound inside your head. And tell me if you can hear it centrally or you can hear the sound more on the left side or on the right side. In Weber's test, the bones of the skull will carry the sound equally to both the right and left cranial nerve number 8. Both cranial nerve 8s in turn will transmit the impulse to the brain. The patient should report whether the sound was heard equally in both ears or better on one side than the other, and this is referred to as lateralizing to a side. And we'll use this instrument again, and I'll be putting this instrument behind your skull and tell me if you can no longer hear the sound. Can you hear the sound?
Yes.
For Rhine's test, we should place the stem of the tuning fork on the mastoid bone, which is the bony prominence located immediately behind the lower part of the ear. The vibrations travel via the bones of the skull to cranial nerve 8, allowing the patient to hear the sound. The patient should inform you when they can no longer appreciate the sound. When this occurs, move the tuning fork such that the tines are placed right next to the opening of the ear. At this point, the patient should be able to again hear the sound. This is because air is a better conducting medium than the bone. Sir, for your cranial nerve number 9. Cranial nerve number 9, or glossopharyngeal nerve, is responsible for taste originating on the posterior one-third of the tongue. We can assess this by simply asking the patient if there is any significant change in their taste. Have you noticed any changes on your taste?
No.
Okay. Thank you for your participation, sir.
So, good afternoon, ma'am. I'm Rovijean Regua, and I'm a medical student from the Lyceum Northwestern University. I'll be examining your cranial nerves number 10 to 12. Is that okay with you? So, let's first start with cranial nerve number 10. For cranial nerve number 10, or the vagus nerve, it provides parasympathetic innervation to the heart, though this cannot be tested easily on physical examinations. When testing for elevation of the palate, the uvula should rise up straight and is in the midline. Can you please take a seat and gulp for me? Thank you, ma'am. So, ma'am, I'll be shining a light on your mouth. Can you please say "ah" long and nicely for me? Ah. For the lesions of cranial nerve number 10, when the palate fails to rise, it is called bilateral lesion. But if one side of the palate fails to rise and is pulled toward the normal side, it is called a unilateral lesion. So, ma'am, we're now done with cranial nerve number 10. We'll go to cranial nerve number 11. For cranial nerve number 11, or the spinal accessory nerve, it innervates the trapezius and sternocleidomastoid muscles. The trapezius muscle permits shrugging of the shoulders, while the sternocleidomastoid muscle turns the head laterally. I'll be checking on your shoulders and neck, if that's okay with you, ma'am. So, I'll put my hands on your shoulder. Please shrug it out for me. Okay, thank you. And I'll be putting my hand on your head. Please push it for me. The other side. Thank you. And lastly, can you please put your chin to your chest and all the way back. Thank you. For the disorders of cranial nerve number 11, a trapezius weakness with atrophy and fasciculation shows peripheral nerve disorders. When the shoulder droops and the scapula is displaced downward and lateral, it shows a trapezius paralysis. The presence of difficulty raising the head off shows bilateral weakness of the sternocleidomastoid. So, ma'am, lastly, for cranial nerve number 12. For cranial nerve number 12, the hypoglossal nerve, it is responsible for the tongue movement. Each cranial nerve number 12 innervates one half of the tongue. Can you please pull down your mask and stick your tongue out? And lastly, can you please push it to your side of the cheeks, to the other side. For the lesions of the cranial nerve number 12, the tongue deviates to the side of the lesion. For example, if the right cranial nerve number 12 is dysfunctional, the tongue will deviate to the right. In a unilateral cortical lesion, the protruded tongue deviates away from the side of the cortical lesion, while for cranial nerve number 12 lesion, the tongue deviates to the weak side. Thank you, ma'am. Thank you for your cooperation.